Today, I will be sharing with us what is hepatitis, the meaning, and why should you care. In this video, I will be explaining to us the various forms of hepatitis. But before I start, I would like us to pause for a moment to share, subscribe, and hit the notification bell. Hepatitis is an inflammation of the liver tissues that causes damage to the liver, and the liver is the largest organ inside the human body. As a matter of fact, the liver performs many critical functions that aids metabolism, including detoxification of blood, production of bile that is important for digestion, and storage of glycogen. These liver natural processes can be disrupted by hepatitis, creating severe health problems throughout the body. Hepatitis have various forms. These may include acute or chronic. As a matter of fact, hepatitis may be acute or chronic, depending on its duration, whether it lasts for less than 6 months or more than 6 months. Acute hepatitis often resolve on its own, but if that did not occur, it may progress to chronic hepatitis. Over a period of time, the chronic form of hepatitis may progress to liver damage, then liver cirrhosis, liver failure, and finally liver cancer. If not treated, most hepatitis is caused by viruses and is classified as hepatitis A, B, C, D, and E. I will be explaining each of the hepatitis types. I will be explaining the various types of hepatitis. But in the meantime, I will be starting with hepatitis A. What is the cause, the symptoms of hepatitis A, and how it is spread. However, the three most common types of hepatitis virus are A, B, C. An infection with any of these three can be very fatal. It was reported that hepatitis A affects about 114 million people globally, and chronic hepatitis B occur in about 343 million people all over the world. That is in 2015. However, in previous year, in 2013, the global estimate of hepatitis B was 257 million. With Africa accounting for about 60 million, while Southeast Asia have the highest with 115 million infected people. Furthermore, chronic hepatitis C accounts for about 142 million people worldwide in 2015. And based on global statistics for hepatitis B and C virus, according to the global statistics for hepatitis B and C viruses, the global is which estimated to be around 360 million infected people. Out of this 360 million, 12% was diagnosed and 1.9% received treatment accordingly. However, there are slightly above 1 million new liver cancer cases, and we also have over 1.4 million annual deaths, and out of this, there is one death in every 20 seconds. Before I continue, I would like us to pause for a while to subscribe and hit the notification bell. I will be discussing the various causes of hepatitis. The major causes of hepatitis worldwide is viruses, which is also known as infectious disease, or due to some other factors or non-infectious cause. Hepatitis A virus. Hepatitis A is caused by an infection with the hepatitis A virus, also known as HAV. The virus is most commonly transmitted when you ingest food or water contaminated with fecal matters. The virus can be spread through the following: eating raw shellfish from sewage, polluted water, drinking contaminated water, and also eating food handled by someone with virus after using the toilet does not wash his or her hand thoroughly. Hepatitis B virus. I will be discussing about hepatitis B virus, the treatment, the cause, and other things related to hepatitis B virus, also known as HBV. Hepatitis B infection is caused by the hepatitis B virus, also known as HBV, and is spread through direct contact with infectious body fluid such as blood, semen, and vaginal secretion of an infected person. The virus can be spread by sexual contact, having unprotected sex with someone already infected, sharing of needle or any other sharp object, like in the case of people that abuse drug, sharing needle. Also, it can also be spread from mother to child. Infected pregnant women can spread the virus to their babies during childbirth. Tattooing is also another form of spreading hepatitis B. Tattooing, body piercing, sharing of razor that is contaminated with infected blood can also be another factor for spread of hepatitis virus. It can be spread through sharing of sharp needles, especially among drug users or people that abuse drug. It can also be spread from mother to child. Infected pregnant women can spread the virus to their babies during childbirth. Hepatitis C can be caused through hepatitis C virus, also known as HCV, and it can be spread through contact with contaminated blood, which usually spread by sharing of needles, especially among drug users, blood transfusion, sexual contact, operation, during pregnancy, during childbirth, or complication of an infectious bacterial disease. And also, it can also be spread through in the case of insufficient sterilization of instruments. Like I said before, hepatitis C infection is caused by hepatitis C virus, also known as HCV, and can spread through contact with contaminated blood, and this can be spread by needle sharing, especially among drug users. Blood transfusion also is another source. Sexual contact. Please share, subscribe, and hit the notification bell. Thank you. Hepatitis D is caused by hepatitis D virus, also known as HDV, and is contracted through contact with infected blood. Hepatitis D only occurs in conjunction with hepatitis B, as the virus only multiplies with the presence of hepatitis B virus. In the absence of hepatitis B, hepatitis D do not infect any patient. It doesn't stand alone in the infectious process. It only occurs when the patient is already infected with hepatitis B virus. Hepatitis E is a waterborne disease caused by the hepatitis E virus. It spread mainly through contaminated food and water, and is mainly found in areas with poor sanitation or poor hygiene. Before I continue, I would like us to subscribe, hit the notification bell. Thank you. I will be talking about the non-infectious causes of hepatitis. First on the list is excessive alcohol consumption. This type is also known as alcoholic hepatitis. We also have the autoimmune disease, certain medications, and toxins. Hepatitis have various signs and symptoms. Some of these symptoms include fatigue, loss of appetite, abdominal pain, diarrhea, vomiting. However, these symptoms should be classified according to the forms of the hepatitis. Like in the case of acute hepatitis. Acute hepatitis may be accompanied by the following: loss of appetite, abdominal pain, and pale stool. That is, the stool will be colored red or darkened. Also, we have dark urine, fatigue, jaundice, vomiting, nausea, fever as part of the symptom. While the chronic hepatitis develops slowly, so signs and symptoms may be hard to notice or detect. I will be talking about diagnosis. To make a diagnosis, your doctor may first review your medical history to determine if you have any risk factor for infectious or non-infectious hepatitis. And if hepatitis is suspected, the type and severity may only be diagnosed through a laboratory test. The following tests can be used: LFT, which is liver function test, to determine how perfectly and efficiently your liver works. This test uses blood sample. However, other blood tests may be carried out to detect and check for hepatitis virus and for antibodies that are found in conditions like autoimmune hepatitis. Also, liver biopsy, where a small tissue is taken from your liver for testing. This helps your doctor in detecting how much inflammation or infection has affected your liver. We also have an abdominal ultrasound, which may also be carried out to take a close look at the liver and organs around it. This test can reveal the following: damage or enlargement of the liver, tumor, if there is fluid in your abdomen, that is ascites. Please, before I go on, please remember to subscribe and hit the notification bell. Thank you. Autoimmune hepatitis is another form of non-infectious cause of hepatitis, and also known as HIH. Autoimmune hepatitis is a chronic and progressive medical condition involving autoimmune mediated inflammation and damage or injury to the liver. And I will be discussing about the epidemiology, which is the demography of the disease. It's more common among women, that is female outnumber males, that is 4:1. It's also associated with other autoimmune conditions. Autoimmune hepatitis is classified into two. We have the type 1 and the type 2. The type 1 is adult onset, is common in adults, while the type 2 is more rampant with juvenile. That's why they also call it juvenile hepatitis. Type 1 is bimodal presentation, that is occur in two stages in one's lifetime. The first one is at between the age of 10 to 25 years, and the other time is between 45 to 70 years. And the classical symptom is jaundice. While the type 2, which is juvenile onset, most often present in children less than 15 years of age. The pathophysiology of autoimmune hepatitis. Also, autoimmune hepatitis the cause is unknown. That's why they also refer it to as idiopathic disease, because they don't actually know the real cause or the real etiology. Subscribe and share. It involves production of autoantibodies that target liver cells in the body, also referred as lymphoplasmacytic interface hepatitis. And in this case, there is always extremely high level of AST and ALT. AST is a liver enzyme, also known as aspartate transferase, and alanine transferase ALT. In this condition, their value is astronomically very, very high. And here also, the total immunoglobulin G level is also high. At least one or more autoantibodies is present here too. The clinical presentation of autoimmune hepatitis, the spectrum of the signs and symptoms, we have up to 25% are asymptomatic. That means they don't show sign of any form of symptom or sickness until disease has gotten to the advanced stage. We also have the 25 to 30% present with fulminant hepatitis, which also means a quick or rapid onset of liver failure. There are non-specific symptoms of autoimmune hepatitis, which includes the following. We have fatigue, nausea, weight loss, and we also have some other signs and symptoms of the liver failure, like jaundice, itching, and ascites, that is accumulation of fluid in the abdominal region. Signs or symptoms of liver failure include jaundice, which is yellow discoloration in the eye. We have the ascites, accumulation of fluid in the abdominal region. The itching, general itching all over the body. Acute hepatitis A, B, and E usually doesn't need specific treatments, as it is short-term, typically resolve on its own. That is self-limiting. Over time, they can resolve on their own. But not that the treatment is not important to it. The general treatment usually involve resting, to take a rest so you can relieve yourself of some discomfort. Then also relieving symptoms of the nausea, relieving symptoms of the abdominal pain, and also vomiting, which can help in a great deal. However, chronic hepatitis B virus may be treated with antiviral medication. Also, acute and chronic hepatitis C may be treated with antiviral medication too. Please remember to subscribe and hit the notification bell. Thank you. Untreated patients can rapidly progress to liver failure or liver cirrhosis, and that is why it is very important to carry out treatment as soon as possible. Acute and chronic hepatitis C may be treated with antiviral medication to avoid being translated into liver cirrhosis or liver failure. In autoimmune hepatitis, treatment may include certain medication to suppress the immune system, as they have been seen to be effective in about 80% of people with the condition. Also, practicing safe sex can help decrease infection of the hepatitis virus that are contracted through sexual contact. Untreated patients can rapidly progress to liver failure or cirrhosis, and drugs that can be used include steroid in the treatment, often leads to complete remission of the autoimmune hepatitis. Steroid treatment often leads to complete recovery of the patient, and the process involves induction, that is, higher dose of steroid can be given to the patient, and over a period of time they can be tapered down, that is, gradually reducing the dose of the steroid, and maintenance dose of the steroid can be given, and or azathioprine can be given also. However, I'm an advocate of combination therapy, because with combination therapy they have been seen to be effective in about 80% of people in that condition over a period of time, unlike with monotherapy, which is not too effective as the combination therapy. Like I said before, practicing safe sex can be a great deal in reducing the hepatitis virus infection that are contracted through sexual contact. To prevent hepatitis, vaccination or immunization is highly recommended and is essential. Vaccinations are always available to prevent hepatitis virus. Remember to subscribe and hit the notification bell. Thank you. Vaccination for hepatitis E is available only in China, but it's not available elsewhere all over the world, according to 2015 WHO report. In the moment, I will be giving the summary of everything we'll be discussing since. But before I do that, I would like us to subscribe and hit the notification bell. Hepatitis. What is hepatitis? Hepatitis is inflammation of the liver. The cause varies, and it can be due to viruses, alcohol intake, drugs, various chemicals. But I will be starting with I will be explaining the summary of all of the hepatitis, right from hepatitis A to hepatitis E. Hepatitis A is caused by hepatitis A virus, and the route is spread through fecal oral transmission, that is fecal oral route, and the symptoms include loss of appetite, diarrhea, fever, nausea, vomiting, malaise, and jaundice. And for the hepatitis A, there's no permanent damage to the liver. That is the positive aspect. Hepatitis B virus is caused by sexual contact, using contaminated needle or any sharp object, and it can result to liver cirrhosis or liver failure, and finally liver cancer. Vaccine is available to prevent hepatitis B. While for hepatitis C, is caused by hepatitis C virus and is spread through blood to blood contamination or transmission, and it can also result to liver cirrhosis or liver failure or cancer, and it's asymptomatic. It presents like flu-like symptoms. And before I continue, I would like you to subscribe and hit the notification bell. Hepatitis D virus is caused by hepatitis D virus, and hepatitis D virus can only be infected with hepatitis D if the patient already have hepatitis B virus, and hepatitis D simply means hepatitis D is inside hepatitis B. Hepatitis D does not infect a patient individually. It occurs in combination with hepatitis B, and there's a greater risk of liver failure, unlike with only hepatitis B. For hepatitis A, 6 weeks recovery time is okay and there's no permanent damage to the liver. Subscribe and hit the notification bell. Hepatitis E virus is also from fecal oral route, just like hepatitis A, and its incubation period is between 2 to 8 weeks duration, and the symptoms include symptoms like jaundice, nausea, fatigue, and so on and so forth. It's the chronic stage it weakens the immune system, especially during pregnancy. The greater risks involve fulmination of liver failure or cirrhosis. There are different types of the types of hepatitis. In summary, there's a chart to illustrate the transmission, prevention, and treatment of the various forms of hepatitis A to E. Before I continue, I would like you to subscribe and hit the notification bell. Please remember to subscribe and hit the notification bell. Thank you. Counseling may help to live with cool condition. Thank you for watching.